Hello, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Center. Today I'd like to explain about the hormone evaluations that we perform to investigate the female infertility causes. When a couple comes to us, both are evaluated, female and male, and we preferably would like to do this hormone evaluation for the female on day 2. However, if day 2 of her period cycle. However, if she is not able to come on period day 2, there are some tests we do, and there are some tests we eventually have to do only on day 2. I'm going to be talking about them. So this video is basically to make you aware that you can do some tests during any time of the cycle, and some tests have to be particularly performed during day 2 or day 3 of your period only, because it gives us an estimation about how your ovaries and endometrium is working. So let's try to understand them. The first is FSH, also called as follicle-stimulating hormone. It's a very important hormone which is released by your brain. These hormones are nothing but signals. They act like signals. Once the bullet is let go of the gun, it reaches the target, which is the ovaries, and the follicle inside it keeps growing. Inside the follicle is the egg. So you will never be able to see the egg on an ultrasound, but you can see the follicle. Follicle is, say, like a house for the egg, and that's where it begins to grow. So this FSH is a very important signal hormone by which this follicle starts growing, responds to that signal and starts growing, and thereby the egg inside it also starts growing and matures to the correct maturity which is required for ovulation and subsequently fertilization and formation of the baby. So this is a very critical hormone which is tested. Next is luteinizing hormone. Now this luteinizing hormone, also released by the same procedure that I have told you, it is released by the brain in a very cyclical way. When the egg is of the right size, the egg needs to be ovulated from the ovary, and it needs to come into the tube so that the sperm can reach it and fertilize. This luteinizing hormone is the most important hormone for the release of the egg. The egg which is growing, which is of the right size, only responds to this rising LH and releases itself from the ovary. So you have to understand the importance of this hormone as well. Next, coming to E2. Now E2 or estrogen is a very important hormone which is released by the growing egg inside the ovary. Now this ovary, this egg which is growing inside the ovary, as it keeps growing, E2 levels rise and it gives a negative feedback to the brain. Alright, the FSH levels are rising, now you can reduce it. So as the FSH levels decrease, the LH levels increase. And this rise in E2 is essential for the rise in LH, and LH, like I said, helps in ovulation. So have you understood the connection between all this? Now comes P4 or progesterone as we call it. Now this progesterone plays an important role on the other side of the machinery, which is the endometrium or the uterus. Now the egg which is releases something called as progesterone from the spot that it has released from. This progesterone is very critical in helping the blood flow increase in the endometrium. So as the blood flow increases, the receptivity of this endometrial layer also increases. So P4 is also a very important hormone that we evaluate. AMH or anti-Mullerian hormone as we call it is an estimate of the way your ovaries are working. Are they working according to the age? Is the ovarian reserve according to your age? Or are they going through something called as premature ovarian failure? Or are they showing symptoms of polycystic ovarian syndrome? All these factors are what we can estimate from this hormone, anti-Mullerian hormone. So it's a very critical hormone in evaluating how your ovarian reserve is, how your fertility potential is, basically, if I may say so, and it's a very important hormone. Next come TSH, like thyroid stimulating hormone. Any imbalances in thyroid stimulation, that is more or less, hyper or hypo, results in imbalances in these hormones as well, in the proper production of sperms and ovulation. So it's very critical that we examine this hormone. If there is an error, like if it is hypo or hyper, what we need to do is correct this and observe for a few months. If the patient gets pregnant on their own, it's very well and good. Otherwise, we can go for next step. So thyroid is a very, very important hormone that we need to evaluate before we even begin fertility treatment. Next comes prolactin. Now prolactin is a very critical hormone which is released during breast milk feeding. So when a mother is breastfeeding, this hormone increases. So you can understand the brain is releasing this hormone to to give the signal that the mother is pregnant and right now she cannot get pregnant again. So the body is going through the phase where it's nurturing a baby. So when in an infertile patient this hormone is high, the body assumes that the patient is pregnant and ovulation does not occur. Because ovulation doesn't occur, the patient may not get pregnant. So prolactin is a very important hormone that we need to assess. Another cause of high prolactin is maybe there is a tumor in the brain. So if it is exceptionally high, we also ask them to do an MRI to rule out the possibility of a tumor in the brain. So these are very critical hormones. Now I have said I will tell you which can be done on day 2 and which need to be done on day 2 and which can be done any time of the period cycle. So remember, FSH, LH, E2 and P4, these 4 have to be essentially done on day 2 of your period cycle or day 3. It gives us an estimation of how your ovaries are at the base level, and this is a good estimate of activity of your reproductive system based on your age. AMH, TSH and prolactin can be performed anytime during a period cycle because your ovarian reserve remains the same any time of the period. If you would like to understand more about these tests, if you want to get them done, if you want to get a second opinion about the reports that you have, please feel free to contact us on the numbers that you see on the screen. Thank you.